Okay, today I'm so excited to introduce my friend and former colleague, Dr. K, and I'll let him share more about himself, but he is just a wonderful human that has worked in addiction medicine for a long time, and I consider him just so insightful and compassionate and caring towards people with substance use disorders and also their families. And so I wanted to bring him on. Hope for the helpers to share some hope, of course, for those of you that are wanting hope in your life. Dr. K, you want to tell everybody just a little bit about you, a little snapshot?
Sure. Yeah, everybody
Okay.
calls me Dr. K. My last name is actually Kauzlarich, but it's bonus points if you can pronounce or spell that. So everybody just knows me as Dr. K. Yeah, I came into addiction medicine first as a patient, but it's been 29 years ago now when I got into recovery. So that was my first experience with it. And then of course since worked in the medical field, both as a primary care physician for about 25 years. And then in the last 12, 13 years, I've been board certified in addiction medicine as well. And so I've kind of worn both hats over the years.
Hmm.
I'm currently sort of slowing down as I get older now, but still doing
Yes,
some
yes.
medical work. And
Well, let me ask you, what did you love most about addiction medicine to start with?
I think for me, it was probably it was, there was a bit of a selfish aspect to it. It was helping me stay clean,
Hmm.
which is kind of, I think, a feature of a lot of us in recovery that, it's the old 12-step concept of you keep it by giving it away.
Sure. Hmm.
And so I think that was always, and I would sometimes tell patients that, I hope I'm helping you today, but I can tell you one thing, you're helping me today. And they would
Hmm.
look at you always sort of
Like, okay.
confused by that, but it was true. It was a little reminder of what I still was, I certainly was sober, but it's a daily reprieve that we all have, and it was good to
Of
be reminded
course.
of where I could be in the heartbeat. So,
Mhm.
so I think that was a part of it, and it was, it's always rewarding to see patients that the light clicks on in their head, and that, oh, they begin to get this, and maybe this can help, and that's always, that's something that's hard to describe, but those that work in that field understand what I'm talking about. That
Oh,
it's
yeah.
such a rewarding thing to see somebody get better and get it, and then occasionally have that patient that comes back 3 or 4 years later and says, "Thank you so much, and here's what I've been doing." And you think, "Oh yeah, this." Because at times in the day-to-day grind, you wonder, am I really making a difference here or not? And then when you get something like that, it's that reminder, yeah, you really have.
Yeah.
Um, and I
Well,
enjoy that. I
I'm sorry. I was just going to say, let me ask you this, since you are a professional in recovery, did you go to treatment yourself or did
I
you
did.
just, okay.
I did. Yeah. It was back in the spring of 97. I went to a facility.
You did go to treatment, and
Yeah.
was it a treatment for professionals or was it just in general?
Well, it's actually, it's still there. It's in Atlanta, Georgia, called Talbot Recovery Center. And it originally had started as a treatment facility for specifically for physicians. But now by the time I was there, they had broadened their scope considerably, and they had all, I mean, it was still probably predominantly professionals. We had dentists, lawyers, pharmacists, nurses, things like that. But there was a significant contingent of people. They call the people that didn't fall into any of the other categories, they're the real people. I was
The
like,
real
it's the
people.
real people. So I was like, well, that explains why I'm not one of the real people. Maybe that's my problem. So yeah, by the time I was there, I mean, their approach to treatment was still largely the same, but they had broadened it considerably. And it was actually a residential type of program where, I mean, it was outpatient, but I mean, we actually had apartments that we stayed in groups, and
Yeah.
so it's kind of a halfway house kind of a setup in a way. You went to the treatment during the day, and then evenings we went to meetings, and there was always organized activity.
And that's something that at some point in my Hope for the Helpers, all the things that I'm going to be doing with it, I want to talk about um, the complications and the hardships that go along with finding a place for treatment and entering treatment. I get families and friends and all the concerned people, calling, asking me, messaging me when their loved one needs to seek
Right.
treatment and they have no idea where to start. It's like, what do we do? Do we call 911? What do we do here? And, there's just so many things you have to navigate. You have to navigate insurance, you have to navigate, location. What if you don't have insurance? What if you are, well, whatever. I mean, there's just all these things. People are looking for faith-based or not faith-based or this
Right.
or that, something for just alcohol or something for all substances involved. And there's just a lot of things. And if you are a regular Joe, like my mom and dad were, you know,
Right.
I did not go to treatment. And I don't recommend that. But if I had said, I need to go to treatment, they would have had no idea where to start. And that's what I
Right.
hear a lot is we have no idea where to turn, what's the first step. And it is the same thing even for professionals because professionals, there's certain places for
Right.
you all specifically if you don't want to go with the general population, there's certain places for you guys as well. Would you have any comments to add to that?
Well, accessing treatment is has challenges in this country to this day because it's so patchwork. There isn't a single way of accessing it, an
Mhm.
entry point for
Mhm.
it. I wish there were. That'd be great if we had something like that. I would tell people nowadays, Google is your best friend. Um,
Yeah. Mhm.
or nowadays, even things like, the AI, chat GPT things, sometimes you can find a lot of resources quickly
Yeah.
that way. And frequently, if I had patients coming from different locales, because, my primary care practice, I had people from a pretty broad area that were coming to see me, and that would come up. Well, I had to find something for them that was specific to where they
Yeah.
were located. Couldn't always be in, say, Johnson City, where we are located. And that's how I would have to. I mean, even I, as an addictions professional, I mean, I wish I could tell you I had, the master book that said, "Here's where you go." I had to research that too. Here locally, we have some pretty good resources. Turning Point's one that I've used before, and there's several others. It depends on what, again, it depends on what you're dealing with the being what's the actual issue at hand. What other, you may, and yeah, it's tough for families because obviously they can't make that assessment. I mean,
Yeah.
frequently, and it's unfortunate that even in the primary care setting, sometimes your experience is variable. I mean, for me, I would say, well, if all else fails, talk to your primary care doctor, that patient's primary
Mhm.
care doctor,
Mhm.
and hopefully they will have some information. Certainly, I did, but unfortunately, there would be some colleagues that may not be as knowledgeable about that or as
Yeah.
up on that. I would get calls from colleagues that say, "Hey, I've got a patient here that asked me what should they do," and so I would, frequently give them advice. And so I've kind of informally become a resource. But yeah, I wish there was a more central clearinghouse for that. But
Yeah.
yeah, it sounds
There's
it's
not.
it sounds sad to try to, Google it, but honest to God, that's kind of what you have
Yeah.
to do
Yeah.
sometimes.
Mhm.
But like I say, I know locally there's some good resources that are
Yeah.
available and pretty easy to access, and we'll work with people from different socioeconomic backgrounds, insurance or no, different things like that. We've had a friend of the family a few years back that we got into treatment at Turning Point that, she didn't have any kind of insurance, but they worked with her, and she's now
Yeah.
been 3 years sober, and it's
Yeah.
wonderful to see.
Um, I've had, just every kind of question asked for me. So I'm going to ask you one. What
Yeah.
do you feel is something that most families or concerned persons wish that they knew how to navigate when trying to help their loved one? And of course, treatment is one of those things. But you worked in addiction medicine for so
Right.
long, years and years, and you had, people asking you things every day. So what is something that is and was hard for individuals and their families to navigate out there? Um, of course, treatment is one, social services and all the different things, I mean, I could make a list, but I want to know from your perspective what one of those things may be.
Probably more going probably more fundamentally before we get into the whole thing of treatment and what resources do we access, things like that is a lot of times I would run into this issue with families of getting confused between support and rescue.
Okay.
And I
All
think
right.
that was a key thing to help them now, because that was frequently a problem you run into is, people want to help, but they really don't
Yeah.
always know where the line is between loving someone and accidentally
Mhm.
making it easier for the illness to continue.
Yeah.
And that frequently was a big education piece that I would have to deal with families. Um,
So give us an example, for example.
well, for example, classic. thing that I would see, and it was, most of the time I was there with parents. Honestly, I mean, of
Yep.
course, it could occur in different situations, but with a parent, you'd have they would have a child that was, adult child that was in the throes of addiction, and they would constantly help them. They couldn't make their rent that month because they couldn't hold the job because of their
Hmm.
disease, so they would pay that, or they would get them, bail them out of jail again, and this, that, and the other.
Hmm.
And always with, now you got to shape up and quit doing this. But they would keep that sort of behavior going on, not realizing, I don't think, that they frequently were prolonging the problem, um, and rather kind of helping them to see that maybe they would need, it would be better for them to sit down and say something like, I love you.
Hmm.
I will help you get evaluated. I'll drive you to treatment. I will keep naloxone in the house, but I will not give you cash. I won't lie for you. I'm
Hmm.
gonna let chaos take over the home.
Yeah.
And that was so sometimes just start with simple stuff like that was frequently what you had to do just from the get-go before you even delved into, okay, now what did we do?
Hmm.
Helping them find resources and things like that.
Yeah. That's definitely, a big one. Individuals that contact me are doing lots of that, helping them with their car payment, paying their insurance,
Yeah.
paying
And
their
it's one of those things that's
fines and fees.
understandable. I mean, I totally get why they do that. And they just don't understand. And that's a tough conversation sometimes, especially with a parent. You try to explain to a mother, you can't keep doing that. And well, I can't let my son be homeless.
Hmm.
I
Hmm.
get that, but
Yeah. Yeah.
better homeless than dead.
Exactly. Exactly.
And we can, if they're still alive, there's still a chance.
Yeah.
Um, and that's and I think the other thing that does it, maybe I think it gets talked about more now, say, than it did 5 or 10 years ago, but I think is really importance of overdose prevention.
Yeah.
Those things at least keep them alive until,
Yeah.
I would I run into that occasion where you get folks that, yes, that
Hmm.
well, that's just enabling them, like, well,
Hmm.
paying their rent for them may be enabling them, keeping the locks on in the house in case they overdose is not.
Yeah.
I don't see
Hmm.
it as that's saving their life so that maybe eventually they're around, get
Absolutely.
clean. That gives it
Absolutely.
another chance. And I mean, I've kind of the opinion in this day and age with the way things are. Frankly, I think naloxone ought to be part of every single house's
It should.
first aid kit. Whether or
It
not you even
absolutely
think
should.
there's anybody in your family even remotely touched by this disease, you never know.
And even for those that are not touched by the disease of addiction, they can
Right.
still overdose on stuff they have at home, that, and,
And not even realize. I've
right.
seen that
And
a few times. Somebody that wasn't it
yeah,
wasn't with the intent of overdosing on purpose, and they weren't abusing it.
right.
Somebody
Hmm.
has terribly chronic pain and think, well, God, I'm just hurting. If I maybe I took an extra one, it'd help, and they don't realize they've really
Hmm.
exceeded something that's not
Yeah,
safe, and they don't know
absolutely.
that.
I think
Um,
about my dad, he had at one point he didn't in his later years, but he passed away last year. But maybe like 15 to 20 years ago, there were times when he did have pain pills in the house. He
right,
had hydrocodone or whatever that they gave him at the time. And he wouldn't have known how many would do that to him. Luckily my dad was like very much anti-medicine, but if
right.
he had taken too many, it'd been great if we'd had naloxone in the house, which we didn't,
Yeah.
So, yeah.
I've been very pleased to see that become much more readily available over the
Oh
counter.
yeah.
That's something I always, anytime I would become aware, family would say, hey, I've got a kid that's doing this, what in the world should I do? Well, number one, let me write you a prescription for this, or go here to your pharmacy and
Hmm.
pick it up. Have this because you might
Yeah.
need it at some point. And then we'll talk about, okay, now what do we do to, locate help for them?
Well, now, since we're talking about overdose prevention, that brings me to harm reduction,
Yeah.
and I talked about harm reduction a little bit on Tuesday in my little mini clip. I do a little teeny tiny something like a 1 minute every day, and Tuesdays are Talk About It Tuesdays. And
Right.
this Talk About It Tuesday, we always talk about something that is sort of shoved under the rug or people don't really want to talk about or something that's very misunderstood, and that is harm reduction. And I was talking about, there's lots of different ways to incorporate harm reduction in your daily life, in our communities, whatever. One of those was naloxone. Another one was the syringe exchange programs. And that's a very taboo
Right.
subject. So many people look at syringe exchange as exactly what you said. They say, oh, why are you helping someone to get high? Why are you help? Well, there's a lot of
Right.
reasons why, exchanging, giving someone clean needles and making sure they have clean,
Yeah.
supplies is important.
I've always long felt that one of the biggest mistakes, and it happens over and over again in this country, but when it became impossible to even purchase something like insulin syringes over the counter, that a
Hmm.
prescription you could do that,
Yeah,
and that was somebody understandable, but somebody's kind of misguided, in my view, attempt to reduce the drug problem. Well, you're not going to. I mean, how does that?
yeah.
It's like if we ban forks, then we'll cure obesity. It's probably not going to work
Right,
too
that's a great
hot.
example.
I mean, is it really? I mean, that's by that same argument, well, then, I mean, is vaccinating everybody for hepatitis B somehow enabling IV drug users to continue to? No.
Exactly.
I mean,
Hmm.
it's not to me. I don't see how you arrive at that argument. Nobody, I don't think, would say that.
Yeah.
So to me, it's kind of akin to the same idea. And so, yeah, that kind of stuff. And you see that hopefully happening more. I know, when I've traveled overseas, certainly in more European countries, it's more common. You
Mhm.
see that's,
So for the everyday family member and the everyday mom or the everyday husband or wife or friend that's saying, well, why would you offer, from a medical perspective, and that's something I can't share, but you can.
yeah.
Why is syringe exchange so important? And how does that reduce harm? For the everyday person, explain that.
Well, it's really primarily from an infectious disease
Mhm.
perspective. Certainly, we talk about, I mentioned hepatitis, which was always kind of your classic one. But I mean, I've treated many cases of years of things like infectious endocarditis, which is an infection or inflammation of the heart valves. It's caused by, bacterially contaminated needles. That's and those are big problems. You see
Mhm.
that frequently, especially in the IV drug users. Yeah, that's not an uncommon complication.
Yeah.
And the ways they will what's the right way? Well, like when people, for example, that are doing injectable drugs, sometimes they to remove impurities from the drug or what they thought they would draw it up in the syringe through like a piece of cotton to filter it, and they used to call that cotton fever they get because they would literally get that injected into the bloodstream, cause
Yeah.
terrible inflammatory reactions and can be quite deadly. So yeah, at least if you're going to do this, let's reduce the risk to you, so at least we're not having to deal with
Mhm.
that as well. It's bad enough that we're dealing with the addiction issue, but let's try to reduce the complications of it as best we can.
Yes. Yeah. Very good. Another question I had for you. What is something that's not talked about very much, but would be very important for someone to know or be aware of if you are that concerned person? So you have a family member that is, in active use, and what was something about active addiction, or even about someone that's that's in recovery that their loved one may not know, something that's not talked about a lot, or sort of a hidden something that everybody needs to know, but they don't know. What would you say? Could you think something?
Oh, there's several different things. I mean, I'm just like which one I would pick. I mean, one probably the biggest thing, if you're talking about the families themselves, is really educating the family about the nature of this disease, in insofar as it is a family disease. Family
Mhm.
members themselves are at risk of becoming consumed by the illness. They can become isolated, they become hypervigilant, they deal with their own shame with this, exhausted dealing with the issues related to the loved one with the illness, and trying to steer them into some support for their own issues, kind of like what you're doing here, which I think
Mhm.
is a fantastic thing to be doing, because I think that's part of the whole intervention system. Um,
Mhm.
it, it just it doesn't. I don't think that gets discussed. Everybody's sleep, their stress level, their trust, emotional life can start revolving around the disease, and
Yeah.
families really need permission, I think, to get support for themselves and not just keep all their attention fixed on the patient. I mean, that's important.
Mhm.
I mean, it's kind of the whole concept, I think, relates to something we see in primary care, and that's caregiver fatigue.
Yeah.
And that's
Oh
very
gosh,
real
yes.
in addiction, just like with any chronic illness. I mean,
Yeah.
and how, and so making them aware that it's that there are resources for them too, and that they do need to take that time for their own self care.
Yeah.
Um, and I think another one that I don't know how aware families are always of it. But I think there's a real importance in when you're dealing with somebody with substance use disorder is if when you get to the point where you may be able to get them some help is it really getting early on assessment for co-occurring mental health issues because very frequently, I don't know the exact percentage, but I would guarantee it's in the majority. You're looking at people that probably have other co-occurring issues
Mhm.
that fuel that, whether it's depression, anxiety, bipolar disorder, something I see get misdiagnosed or missed a lot. I have
Yeah,
patients come in and it's like, they've had these issues for years, in and out, depression. Like, this is bipolar disorder. Yeah.
yeah,
And
yeah,
it certainly, if you don't treat co-occurring disorders with that, it makes it a lot. I mean, you can still treat somebody for addiction, but it's a lot. You're pushing a rock uphill
yeah.
more than you need to be if you can get adequate treatment for that as well. And I would
And
see
for
that sometimes where families would get somebody into like a little outpatient, some of these places where they would just get them on buprenorphine, which is helpful, but that's kind of all they did, and there wasn't a
Mhm.
lot of other attendant
Right.
services being rendered, and so we were kind of missing the boat because, well, we were putting a band-aid over this, but there's some other stuff going here that if we treated that adequately, we would
Mhm.
have a lot better chance of success in the long run.
And for the average Joe out there, because I would imagine that people that watch this are probably average Joes like I am. And I've been taught this, but most people maybe haven't. Share with us how the disease of addiction actually works. I mean, what does that mean exactly? Because a lot of people will think, well, they're addicted, but how did that happen?
Right.
What's the medical, in layman's terms, how did that happen? Because we want to make sure that
Right.
individuals understand that this is not a nobody wants this to happen. They don't go into this thinking that's what's going to happen. And it's not because they, don't have any willpower, and it's not because they are a bad person or anything. I mean, addiction is something that can happen to anyone, of course. So,
Yeah, yeah, I wish it was as easy. We just can just will
mhm.
it away. If
Yeah.
that was the case, we wouldn't have this issue in the first place. Yeah, it's
Right.
definitely something that and we're still learning more about it all the time from a medical science standpoint, but it's certainly fairly well understood that there is a neurological basis for the condition that exists within the brain itself and the brain's reward system. And one of the best ways I heard it put years ago to help somebody understand it was using a kind of a real world example. Imagine not that you have addiction, but imagine that you get stranded on a desert island with one other person,
Mhm.
and the other person is the one that has all the water, and you don't have any.
Mhm.
And
Mhm.
eventually, you would get thirsty enough, you would be willing to cheerfully commit murder to get that water when you ordinarily
Mhm.
would never do anything like that. And most people
Exactly.
can see, well, yeah, if I was, I mean, they know it's like to be thirsty and they can sort of imagine if
Hmm.
that was bad, if I would do anything to get that water. And
Hmm.
what I will tell people is, well, imagine then the brain of the addict, people with addictive substance use disorder, that reward circuitry that drives that is miswired in us.
Hmm.
And even though we know intellectually that I'm not going to die if I don't take that drug, it feels that way.
Yeah.
We get driven, and that's the compulsion we have. And even the addict themselves doesn't really understand that compulsion, but they know it's there, and
Yeah.
we're frequently mystified by why can't I do? I mean, I know how many times before I got recovered, I would have that conversation with them. Why am I keep doing this? I stopped this, and then I do it
Yeah.
again, and
Yeah.
why did I do that again? Um, and it does look strange to the outsider. Well, why don't you? Well, I don't know how to explain it any better than that.
It's a great analogy. Yeah.
And there's definitely and in my case, there was certainly a family inheritance patterns. And most patients, when I would discuss family histories, if they knew, you could find, yeah, there was some genetic component to it. I think there's a combination of environmental and genetic factors that trigger it.
Of course. Hmm.
But it's not I always said I didn't catch it from a dirty toilet seat.
Right. No, no, exactly.
Yeah.
Yeah.
I
Okay.
come from a long line of generations of hard drinking Croatian coal miners. Like like I think that gene found its way to me somehow.
Yeah. Well, the same thing with me. My father's father, my grandfather, was an alcoholic and died from complications, from that. At a young age, he was like, I think he was only in his 60s when he passed away, or maybe 50s. He was young though. I never met him. I was born way after that. Um, and I do have substance use, in my family on both sides, here and there.
Right.
So, I'm not the only one. I'm not the only one. I'm probably the only one that talks about it. I'm the only one that identifies as, a person in recovery or a person with substance use disorder. Nobody else in my family does, but it's there,
Yeah.
and I
I
know
think
I ended
it's
up here.
it's I suspect it's better than it used to be, but we still have a long way to go, I think, in destigmatizing it because
Mhm.
honestly, it's relatively common. People don't want to
It's
talk about
very
it.
common. Yeah,
It's
yeah.
not unusual. I mean, you're
No.
talking probably anywhere from 10 to 15% of the population at some point in their life would qualify for the diagnostic criteria for this. It's not unusual, and yet we don't. It's. I mean, better you be a horse thief than be an addict. Oh my God, that's like
Oh,
the worst.
yeah.
Like, well,
Yes.
if I was diagnosed with bone cancer, I would be very sad and upset about it, but I don't think I'd be ashamed of that fact.
Yeah,
You know,
exactly.
that'd be just what I have to deal with, and I think still that's kind of what keeps people from accessing it the way they might otherwise if there wasn't that stigma to it.
Yeah.
Oh, we just don't want to think that could be the problem. Maybe you're just depressed, and we'll just get you. Well, if it was all depression, Prozac would have cured addiction decades ago. Uh,
Yes. Right. So lastly, what would be your advice to the concerned person that's watching on how to find hope, on how to um, grasp hope, on how to see hope when they feel like everything around them is crumbling? Because that's probably what's happening. They're thinking, "Oh, my life is over. This is happening to my family member, and I'm not really sure how to deal with this, and I'm losing hope." What would you say?
it is tough sometimes to get people to do this, but I still am a firm believer that the best way to find hope in this, whether you are a loved one with someone with substance use disorder, or you're the addict themselves, because I know this was the case for me, getting into some of the community resources, for example, 12's Al-Anon is a great
Yeah.
example. And then that's
Hmm.
not the only one, but support groups where other people who are dealing with what you're dealing with. There is always strength in numbers there. And there
Yes.
was something oddly comforting to me about realizing that I wasn't unique in all
Hmm.
this. And I know in early recovery, when my parents were involved in some family work at Talbot, I mean, they've reflected back how that's been helpful. That was helpful to them,
Oh, yeah. Hmm.
realizing that, this really wasn't their fault. It wasn't something they made me do, or it was just, it's interesting the things that family members blame themselves for, and the guilt they, oh, if only I'd done this or hadn't done that, that's
Yeah.
not really the problem. And when they realize that other people go through that, I think that those community resources are the most help to them, because I don't know that I can give somebody a wise advice to say, oh, it'll all be okay.
No,
you know
no.
does that
And, and,
that doesn't
and it may
help.
not be okay, because it
May
may
not be
not
okay.
turn out okay. Yeah.
Yeah.
Hmm.
Yeah, and that's the other thing I think is being realistic with people
Yeah.
is to try to. Sometimes people will yo-yo between utter despair and magical thinking.
Hmm.
We got to
Hmm.
get them in the middle. That
Yeah.
there is hope, and there is, as long as they're still alive and breathing, there is always hope.
There's always hope.
There's no
Hmm.
magic cure either.
Right.
I always tell people, I would tell my patients this: recovery is not an event; it's a process.
Yeah.
It's a long process. It's an ongoing, lifelong process. It's just a new set of habits you have to cultivate, in a sense. But I wish it was just, I just got struck sober and I'm all good now. No, it doesn't work that way.
Right.
um,
No, it does not.
29 years and I'm still, I thought, well, I'm playing today.
Listen, I'm 20 years, in recovery, and I think every day, because I do this kind of work,
Yeah.
I'm reminded. I'm sort of like you were talking about in the beginning. I'm reminded of where I can be, where I could be, where I could have ended up, and
Right.
and what could happen tomorrow. So, I try to, keep that in perspective, because every day is a day to live or it's a day to go down the other road. And you just have to try to make wise
But my old
decisions.
one of my old sponsors, you tell me you're either getting closer to a drink or further away from one. Which
Yeah.
is it? There's no third
Yeah.
option.
Yes, 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 yes. Well, you have been such a wonderful addition to my day, and I know anybody that watches this when we get it out there is this is going to be so great because you've answered so many questions that I know many family members and friends and work coworkers will want to hear and will be excited that they have heard from you. And you're
Well, I
just
hope so.
you're a lot in this world, that is for sure. I'm just so thankful for you.